murder.
Thank you, guys. February is Heart Health Month, and today is the day to go red for women's heart health.
You can see we're wearing red today. It's all designed to bring awareness to the fact that heart disease is the #1 killer of women in the U.S. And joining us to talk about it, Dr. Jim Sir, cardiologist from MetroSouth Medical Center in Blue Island, or St. Francis for the old schoolers like me. So, well, let's start before we get to the snacks, Dr. Sir. Why don't you tell us, why is it that women are more affected by heart disease than men?
Well, you know, we see heart disease as a prevalent disease in women as much as men, but I think the problem is it's under-recognized. And the reality is it tends to take more women's life than men's life. And I think part of it's because of detection. It's just under-detected. Maybe the symptoms aren't understood and appreciated as heart disease. And about 60% of women die without any symptoms.
Wow.
As I enjoy a grape here, and I'll pass one on in a second. What advice do you have for women to prevent heart health disease?
Well, I think it starts with identifying the risk factors for heart disease. Talk about your family history with your family members. Identify how prevalent it is in your family. Cholesterol, blood pressure checks, and then really taking an attitude that it can affect you. And also, the other part of this is, I think the nagging wife often doesn't get enough credit, because men, their heart disease is identified often because they have a lovely nagging wife who brings them into the hospital, whereas women put their children first, they put themselves on the back burner. And I think allowing women to take today to recognize this day and the prevalence of heart disease in women to, you know, put themselves in front for once.
All right, Dr. Sir, and of course, eat lots of fruits and veggies and good healthy food.
I've always been told every color of the rainbow.
Yeah.
If you want to be healthy, eat every color of the rainbow.
There's a great benefit to all this, for sure.
All right, Dr. Sir, thank you for coming in this morning. You bet. Time now, 5